That's where our anesthetics bind. They got a multitude of different subtypes of receptors, but they're very important in brain development and brain functioning, and they exert organizational activity in the brain. And certain compounds, and these are our progesterone derivatives, we call them the 5-alpha reduced pregnanes, they can cross the blood-brain barrier. However, the brain makes this stuff on their own from cholesterol via progesterone by this 5-alpha reductase. And I mentioned the 5-alpha reductase because there are some compounds that inhibit these, and they may be another form of therapy that we could use. So it's good to know that this ding GABA receptor, it's a giant chloride ion flux, and it can open or close, and it can have immediate effects. That's why when you go in to get anesthetized, you get that drip started and you say, they will ask you to count. You don't get past going past 10 backwards. It works very, very fast. So we think that there's something going on with the squeeze, and it's going to be the GABA receptor in the brain. So it also influences gut motility, the vagus nerve, and how many things does that control? Autonomic regulation. And it's important for what they call phasic and tonic inhibition of consciousness. So we got these compounds in the foals working on this receptor. We know that from not from taking the brains out of foals, but from all these other experimental models with that. So the breakthrough is a condition known as neonatal maladjustment syndrome, is associated with persistence of hormones secreted in utero to keep the foal in a sleep-like state. That's a fact. And when you try to compare what we're dealing with in utero with a maladjusted foal, some of these severely affected, brain function, depressed, respiratory, we have to use respiratory stimulus